Hi everyone, Dr. Emery from Pain Free Infinite Posture Size. Today we've got a great video lesson on how to train your legs heavy. Great workout for your legs without aggravating disc problems like herniations, bulges, and degeneration. In this part one of the two-part series, we're going to be talking about one-legged movements. Hope you enjoy. So one of the biggest challenges we have when we are suffering from a disc problem, such as degenerative discs, herniated discs, or bulging discs, and we still want to get an effective leg routine in, is how to stimulate our legs, how to bomb our legs with a heavy workout without aggravating our lower back. There are 5 one-legged basic movement patterns that are fantastic for training legs when you do it on one leg. One-legged training versus two-legged training allows you to use a lot less weight. If I were to squat on 2 legs and use either a barbell across my shoulders, a zerker squat or front squat, even a leg press machine with 2 legs, there's going to be a lot more weight being used to stimulate both legs simultaneously versus using a one-legged exercise, such as a one-legged squat, where we're going to inherently have less weight associated, but we're going to have a lot more stress on the leg itself. So, before we get started, remember that this series, as well as any healing exercise series, is based on knowing what your RPI is. If you don't know what your unique mechanical problems are, your postural alignments, your movement tendencies are, please go to either the Posture Size or painfreeandfit.com website. We have a free body analysis. Learn where your inherent biomechanical weaknesses are, where your stability issues are for your lower back. If you want to protect your back with leg training or any other type of exercise or movement, you have to learn uniquely for you how to engage your proper muscles, how to relax those muscles that are over-tensing, and how to position your spine, your pelvis, your torso, so you put yourself in a neutral spine, creating the least amount of compression and irritation on discs. Discs, remember, inherently are more aggravated when we have flexion or bending forward motions on them, as well as vertical compression motions. So these 5 exercise movements we're going to talk about today delete most of that. Number 1, we're going to talk about the one-legged squat. When we squat on one leg, and if you're not used to one-legged squatting, you can hold on to something for a little bit of balance. Hold on with your free leg, not your standing leg. We're going to make sure that we use the same motion pattern as a normal squat, as a normal hip squat, which is hip moving backwards more dominant than knee moving forwards. So if I try to one-legged squat with my knee moving forwards, like a pistol squat type of movement, I'm going to lose the stimulus on my glutes and hamstrings and lower back. So what I want to do is I want to emphasize a rearward motion of my hip joint. And if you notice, like a normal hip dominant squat, I want to keep my eyes and chest looking straight forward. If I try to look up, that's going to increase the arch in my lower back. That may aggravate my particular disc condition. So I want my eyes and chest always following the same arc of motion. That keeps alignment between my tailbone and my head, creating a neutral spine in my back if I have my RPI engaged. From the back, what you're going to notice is the mistake with one-legged squatting is hip hiking, where the hip comes up, and torso side leaning. So as I descend, I want to make sure the hip is lowered and the torso lifts up, so I have an equal or level pelvis and rib cage during that squatting motion. Now from the beginning, for those of you who are not used to one-legged squatting, just using body weight during the motion is tough enough to get a good burn. You can use 20 reps, 30 reps, or even higher building up to get a good burn. With one-legged squat, you're going to feel it a little bit more in your side of your hip joint, the glute medius, the TFL. You're also going to feel a lot of glute motion. There's not a lot of stress on the lower back because I don't have that additional weight. If I choose to hold dumbbells in my hand or a bar across my one thigh, called bar thigh squats with a one-legged squat, I can keep that trail leg back there to tap for a little bit of balance as I go through the motion. No stress on the lower back, or very little stress, because the weight is engaged on the thigh, pushing in my thigh, bypassing compression on the lower back. I can also, besides a one-legged squat, use a split squat or lunge. That's a great way to train myself in a one-legged position. So what we're going to do with this is we're going to put one leg back, one leg forward, and slowly descend. Now, if you're not used to split squats or stationary lunges, they put a lot more tension on the front of the quad on that back leg. That's because one of the quad muscles, the rectus femoris, is being stretched as that leg goes back. I'm using a more up and down motion here, not a forward tilting motion from the hip as in a one-legged or two-legged squat. And I'm keeping myself vertical. A lot of hip motion, a lot of glute motion, not a lot of stress on the lower back. Again, if I'm going to use a barbell on my lead thigh, I bypass compression in my lower back as I perform this bar thigh split stance or stationary lunge movement. Similar to the one-legged squat on my front leg, I want to avoid the tendency to hip hike and torso side lean. I want to keep a little motion of that hip down and rib up as I go through that pattern. Bypassing compression on lower back, sparing your degenerative discs, herniated discs, bulging discs, but still getting a great workout on the leg. We can advance that into a Bulgarian style split squat, where we take that trail leg and we place it on something higher behind us. This puts additional stretch on the rectus femoris. We have to counter that with tailbone under so we don't overarch the lower back the deeper we go. If you have tight hip flexors, tight rectus femoris, the deeper you go with this, the tendency is for the tailbone to come up, overarch the back. If extension bothers your disc problem, that's going to irritate you. So make sure you can even keep one hand behind it and monitor that there's no increased arch in the back as you go up and down. Again, we want to keep that lead hip down, lead rib up. We can use one-legged training to target more the glute and the hamstring in a one-legged stiff-legged deadlift. This motion, again, holding on if you're not used to this from the beginning, is simply pivoting our body, our ear, our shoulder, our knee, and our ankle, all pivot around the standing hip. If you notice, I'm not allowing my leg to go back further than my torso. I'm not allowing my torso to go more forward than my leg goes back. I'm keeping a straight line between ear, shoulder, knee, hip, and ankle as I perform the motion. Due to hamstring flexibility, some of you will be able to go a little further. Some of you may be limited. Hamstrings many times are going to be tight in chronic disc problems. So go within a range of motion that feels comfortable. Similar to the other one-legged exercises, I have to watch out with that for that same problem. As I'm going back, I'm going to have a tendency, the deeper I go, to hip hike and to side lean. I want to keep the hip down and the rib up. The other problem is that my pelvis will normally want to turn away from the standing leg. I want to make sure that we keep the pelvis turned in so that I'm square with my body and not rotating that lower back. I can also use the one-legged style of training with an exercise called the step-up. This is a great way to stimulate legs, hamstrings, glutes, quads, without aggravating lower back. What I'm going to do is use a box or a step of varying heights. It's going to be easier when you have a lower step, like a normal step. It's going to be harder on a higher box or bench. Again, you're going to start the exercise by engaging your RPI, keeping the hip down, rib up on the front leg, and you're going to come straight up from there. You'll notice that I'm not emphasizing a forward knee drive. I'm trying to keep my body positioned so I keep my kneecap behind my toe line and use a vertical ascent motion as I come up. The slower in cadence I go, the more difficult balance it's going to be. Again, if you have something to tap onto to give yourself a little bit of a balance, that's going to help. I would reserve this in terms of higher steps for when you get into better shape using those stationary lunges, split squats, one-legged squats, and build up from a 4-inch block, 6-inch, 12-inch, and eventually go up to 18, 24 inches. A high block, one-legged step-ups is a great exercise. If you want to use weight with any of these exercises, you can start with light dumbbells in your hands, or as I explained, a bar thigh situation. Light dumbbells on a one-legged exercise, whether it's a squat, it's a lunge, it's a step-up, even a Bulgarian, is going to produce a lot less of vertical compression in your back than a heavy barbell. You're only going to be able to hold, because of hand strength, dumbbells that are certain heavy or a certain amount of poundage. It's not going to be as much as if you use the barbell. Also, because you're on one leg, you're going to have to use a lot less weight. A one-legged squat by itself is challenging. A one-legged squat holding 20 or 30-pound bells is very challenging. 50-pound bells is very challenging. Versus a workout with two-legged squats, 30, 50-pound bells, may not be that challenging. You're talking about balance, talking about coordination, and it results in less weight having to be used for a great pump, a great workout in the legs, the hip complex, but not that compression on your disc. If you enjoyed this video on training your legs without aggravating degenerative, herniated, and bulging discs, feel free to subscribe to our channel. We've got a lot of great training videos out there for lower back and other types of musculoskeletal pain. If you're looking for a great workout program to figure out how to help heal your lower back, your degenerative herniated discs, check out our degenerative disc fast track program available at the painfreeandfit.com website. Questions or comments, write in. I'll be happy to answer them. And I hope this video on leg training with degenerative, herniated, and bulging discs helps you with your leg training and chronic lower back pain.